Good morning, everyone. Today we are reporting 67 new cases of COVID-19 in the state. This does include 9 new hospitalizations, as well as 4 new deaths, 1 among a Beadle County resident, 1 among a Buffalo County resident, 1 among a Lyman County resident, and 1 among a Pennington County resident. We have had 49 newly recovered individuals in the past 24 hours, as well as 931 new negative tests that have been performed. This does bring our total of COVID-19 cases to 6,893 for the state. Of those, 814 are considered active infections, and 5,982 are considered recovered. We do have 64 currently hospitalized individuals, and our total of 97 individuals who have died. And we have 75,048 persons who have tested negative for COVID-19. Our updates for the community impact map include Brule County being elevated to substantial community spread, and Millette County being elevated to minimal to moderate community spread. Our updates for clusters include no update for the Smithfield Food Cluster. We have 166 of 170 Demcota Ranch beef employees that have recovered, 119 out of 128 Jack Links employees that have recovered, 88 out of 103 Dakota Provision employees that have recovered. And for the Avantera Arrowhead facility, we have a total of 38 of 66 residents and staff that have recovered. So our new cases by county include 5 in Beadle, 3 in Brookings, 2 in Brown, 2 in Brule, 1 in Buffalo, 1 in Charles Mix, 2 in Clay, 2 in Coddington, 1 in Custer, 2 in Davison, 1 in Day, 1 in Douglas, 1 in Hanson, 2 in Hughes, 1 in Hutchinson, 1 in Lake, 5 in Lincoln, 3 in Lyman, 1 in Millette, 11 in Minnehaha, 1 in Oglala Lakota, 13 in Pennington, 1 in Tripp, 2 in Union, 1 in Walworth, and 1 in Yankton. For our deaths by county, and we have 7 in Beadle, 2 in Brown, 3 in Buffalo, 1 in Falk, 1 in Jackson, 1 in Gerald, 1 in Lake, 1 in Lincoln, 1 in Lyman, 1 in McCook, 1 in Meade, 58 in Minnehaha, 17 in Pennington, 1 in Todd, and 1 in Union. I did also want to mention that we do have an update on our dashboard today that includes the percent positive, and that includes percent positive for 1 day, for 7 days, for 14 days, and then cumulative total testing. It is noteworthy that this does reflect the total number of tests that have been performed. Most of the rest of the dashboard is person-centric in that as you're looking at, say at the very top, 8% of all individuals who have been tested have tested positive versus the 7% of all, so cumulatively across the state, 7% of all tests have been positive. So there is a difference in terms of whether we're focusing on tests, which is that new dashboard, that item that has been added today, and the rest of it is person-centric, so that we're not duplicate counting of hospitalizations and individuals who have tested positive more than once. So I think with that,
I will unmute the lines and we'll take your questions.
This is Morgan from the Rapid City Journal.
Go ahead, Morgan.
The fireworks event tomorrow won't have social distancing enforced, and masks will also be given out but not required. So what input did the Department of Health have on this event? And I guess what guidance could you give attendees based on the science and facts about both the social distancing and the mask wearing?
Yeah, I think so the South Dakota Department of Health did provide input to the Department of Tourism on the July issue. So, we did discuss that the larger recommendations around individuals, which is individuals are washing their hands frequently, going to a crowded area such as that. There is social distancing, but that's why it is more important for the other aspects of individual precautions, such as that hand washing, wearing a face mask, and keeping as much physical distance between yourself and other individuals is important. What I would say is that the guidance has not changed in that respect, that individuals do need to take the precautions into their own hands when they are, out, whether it be grocery shopping, going out to other events, such as picnics and fireworks celebrations, including the fireworks celebration at Mount Rushmore.
Next question.
Yep.
Ben Chase with the Huron Daily Plainsman.
Go ahead, Ben.
Yes, some of our neighboring states are putting together public testing events where they are inviting anyone who wants to come get a test done at a central location to come and do that. Is that something that South Dakota is planning, and if not, why not at this point?
So I think, we have a focus of trying to maintain or exceed the testing of 5% of the total population of the state each month. And I'm happy to report that for the month of June, we have exceeded that testing level. So we have in fact, exceeded it by testing over the 44,000 individuals that we have set as a goal for ourselves, and it's been over 48,000 tests that have been performed in the month of June. We do focus on continuing to maintain that high level of testing, and so I think we will continue to assess where we're at with testing and look at working with healthcare partners to expand testing, as other states have done.
Next question.
Hi, Todd F. Kello.com News.
We'll go with Todd.
Thanks. Got a couple of questions on contact tracing. The first one is, I'm talking to my boss's boss yesterday, and he goes, Todd, look at your iPhone. You're going to be surprised what you find. I said, what's that? And he goes, there is a COVID-19 tracking app on your iPhone. And I said, well, I don't remember ever downloading that. Sure enough, go into the guts of the settings, and there it is. And I also have an Android phone, and there was a similar app there. So why am I getting COVID-19 apps, tracing apps that I didn't request?
So I guess I'm not familiar with your phones, but what I would say is, I do know that both Apple and Google do have the Bluetooth capabilities, that then would be used as a foundation for any specific apps. So without knowing exactly what you're looking at, I don't know if you're looking at the core functionality within the operating systems across Apple and Google platforms. or if you may have in the past actually downloaded an app that does contact tracing, such as Care19 Diary, which would help provide individuals with the opportunity of identifying places that they had been, and is a helpful reminder when individuals may test positive. But I would say that I would take a look at those. If it really is an app that you did not download, that go ahead and have that removed off of your phone.
And I guess, well, related to that, Josh, I mean, I did download the Care19. I mean, I made a conscious effort to download that. Just for some feedback for you, I ended up taking it off because it was sucking my iPhone battery dry. My other question regards the more traditional contact tracing. A number of states, at least reported like by the Washington Post, New York Times, say that some of the larger states have had really difficult times with contact tracing, particularly when you compare it to countries like Korea and so forth. What's the state of contact tracing in South Dakota? How many people do you have doing it? What's been the results of the contact tracing?
Yeah, so what I can say along those lines is that, we have continued to have, really good interactions with individuals. No one likes to hear that they've been exposed to someone with COVID-19, but by and large, individuals in South Dakota that have been notified of this are taking it seriously and, are complying with the recommendations being put forth by the South Dakota Department of Health. As always, we do have some individuals who, do have a little bit of difficulty, either quarantining to home or, isolating at home. And so, we do help provide wraparound services or work with locals within the community to help provide those wraparound services for individuals, which does decrease the barriers that individuals have to staying home for 10 or more or 14 or more days. And so what I would say is that we have not had that level, some of that level of difficulty, I guess, with working with individuals within the community, and I think that is a little bit reflective of individuals in the state, doing the right thing, taking their own individual precautions, and making sure that they're avoiding areas where they may have been exposed, or taking proper precautions if they are out enjoying festivities and so on.
All right, thanks. Have a great 4th.
Yes, you too.
Next question.
Gordon Richard, Alcester Union, Hudsonite. Dr. Clayton, would you describe the Rushmore fireworks as a potential super spreader? I've heard your comments about what people need to do, but is it in fact possibly a super spreader?
Well, typically when we're talking about super spreaders, we're actually talking about an individual's ability to spread disease fairly widely to a large number of their close contacts. But what I would say is that individuals do need to take proper precautions when they're out enjoying festivities, and I would say whether that's at the 4th of July fireworks at Mount Rushmore, or just having friends or family over in your backyard, making sure that any amount of this like social mixing and engaging with others in the community does offer a little bit of a risk for the transmission of COVID-19, and people just need to take precautions to avoid that from happening.
Next question.
Jackie with SDPB.
We'll go to Jackie with SDPB, and then we'll go to Jeremy.
Thanks. Dr. Clayton, is the Department of Health encouraging people who attend the gathering at Mount Rushmore to self-isolate or be tested for COVID-19 after this weekend's event?
So there is no such recommendation. The focus on self-quarantining or being tested really does come down to whether an individual is considered or has an exposure event. Just because there are going to be individuals that are going to be in close proximity, that does not, equate to an exposure event in and of itself. But again, coming back to that core messaging of individuals taking precautions that would decrease any potential transmission if somebody were sick in that setting or at somebody's backyard setting enjoying the 4th of July fireworks.
We'll go to Jeremy now with Forum News Service.
Yeah, somewhat related to that question, I guess, is I just wonder if there's any conversation about potentially setting up quarantine expectations for people visiting from states where you're really seeing COVID popping off right now when it comes to Texas, Florida, Arizona, that kind of thing. Is that a conversation that's happening at all?
There are some states that have done that, New York, New Jersey, Connecticut among them. At this point, we have not entertained the idea of, requiring individuals to self-quarantine when they're arriving in the state. I do think that it really, individuals who are, sick with symptoms, should remove themselves from any events, whether that be travel associated or not, and that individuals who are considered exposed should take their quarantine seriously. But beyond that, we are not recommending that individuals entering the state need to quarantine for 14 days.
Okay, thank you. And just a quick follow-up as far as testing goes. You mentioned, hitting the numbers or surpassing the numbers you were looking for on a monthly basis last month, and of course, that testing in senior facilities, that certainly superpowered that. And I just wondered, there's a lot of testing capacity that's available and doesn't seem to be being used on a daily basis. So I wondered if, as you're looking forward to, either mass testing events or other types of large testing to potentially hit that monthly goal, what are you doing there?
Yeah, and I think that's exactly why we've started to monitor kind of where we're at, and wanted to share the fact that we did exceed our, monthly testing goal for June, and that we'll continue to monitor that within July, and try and make sure that we're meeting or exceeding that, and that does include taking a look at doing, testing or working with partners to conduct testing that we've not done so far. So I would say that, we're always looking at making sure that we're offering testing, especially to those who are considered symptomatic, that there are some new guidelines from CDC around testing asymptomatic close contacts, and that, with that combined with some additional testing in special populations, we hope to maintain or exceed that 5% again for July.
Okay, thank you.
All right, well, we have time for one more question. Last call for a question.
Bueller?
This is Mark with the
Go ahead, Mark.
AP is reporting that they cannot trace large outbreaks of COVID due to the protests. We've had some protests in South Dakota. We're going to have large outdoor gatherings, whether it's a rodeo, the rally, the fireworks. How much does outdoor exposure reduce in transferring coronavirus?
That's a very interesting question. So there has been a study that was published recently that looked at the effects of protests on cities greater than 100,000 population. And they did find that overall the cities that experienced protests did have a little bit lower number of COVID-19 cases. And I think that is related to the avoidance behavior of the larger portion of the population from potentially mixing, whether that's at events or at work or so on. And that, that combined with the fact that there are a little bit of different transmission dynamics when you're talking about exposures that happen inside the home versus in an outdoor setting, and that the temperature and humidity and wind do play a factor in potential for transmission in an outdoor setting. And so, I think the overall net effect is that there's a little bit decreased risk of transmission in outdoor settings such as that. But all of that is, still kind of early on in the literature and is not reflected in any specific CDC or South Dakota Department of Health guidelines. But it is interesting to note, what some of that impact might be for outdoor events, whether it be protests, fireworks celebrations, and so on. And we do continue to monitor for, symptoms, monitor cases and identify when we have instances where we have a large number of people who might have been exposed, and we would need to do a public notice. So we do continue to keep that as a possibility for our case investigation and close contact notification.
All right, thank you all for joining us today.